Hi guys, I'm answering another of your mental health questions. This is a very, very good question and could end up being controversial. You asked, what are your views on forcing medication on psychiatric patients, whether they are or are not dangerous in any way? And I think you mean if the patients are dangerous rather than the medication. So, I'm of two minds when it comes to that. I think that there might be a lot more over medicating happening these days than what is absolutely necessary. And that's because it seems like we're trying to fit people into some sort of societal norm or expectation. And I've often wondered how many Van Goghs and Einsteins are we suppressing because we're trying to make them normal, to fit a societal expectation. Medication does a lot of times dull people's senses and their feelings, and some of the most creative and artistic people in history clearly had a mental health disorder like bipolar. So, but the flip side of that is those people often also were quite tortured and miserable and a danger to themselves or to others. So the view that I look at mental health, mental illness as a whole is it hurting you or someone? Something is not diagnosable normally as a mental illness or an issue unless it is causing impairment in some form or fashion in the person's life. And that impairment could be something like an inability to form or keep healthy relationships, an inability to work. I mean, it could be something that borders, in my mind, on, is it an impairment or is it just that they're not meeting a societal norm? So there's a fine line there. I think it's perfectly fine for someone to be quirky, to be a little odd, to be different. I mean, those kind of quirky people are amazing and awesome to me. How much of that is something that we should suppress in a person in order for them to fit in and be normal? And how much of that is we should just let them be who they are, even if they are a little odd or a little different. But when that person is seeing impairments in their life and it's something that they want to change, then that's when they're going to be motivated to want to do something about it. And maybe they do want to fit into that societal norm, that's their call. But I do realize that the question is about forcing medication on someone. And there are going to be times when someone is so out of their mind, psychotic, to where they're not in the right mind to make decisions for themselves, and something does need to be given to them, maybe to calm them down or whatever in that moment. I think that's okay. That's a good use of, forcing a medication on someone because they're just not in the right mind in that moment to make that decision for themselves. But I think you might be talking more about forcing that long-term medication, such as that monthly injection of, is it Halsol or whatever, that's normally given to people who have a tendency towards more psychotic behavior. Then you're getting into a gray area. If there's a proven track history of every time they're not on the medicine, they become so psychotic that they have to go inpatient, that they need to be struck down, and, it's this whole big ordeal, then, again, I hesitate to say, yeah, it's a good idea to force them to do that medicine because as an adult, there's this whole concept of free will, right? So it's a gray area. I really can't give a right or a wrong as far as a hard drawing that line of yes, it's okay or no, it's not. That is one of those areas in life where there's shades of gray, that everything's not black or white. I would say that it depends on each situation, on each circumstance, on each case. So I'm saying, yes, I think there are times when it might be justified and it might absolutely be in the best interest. But I also see times where it might be more of society or family members or whatever being uncomfortable with someone's differences. They might feel better medicating them to make them feel normal, and that's when I think it's not okay. But I am not going to give a hard and fast yes or no answer one way or the other, because in my point of view, I would want to take it case by case basis and see what is best in that situation. So I just did a really good job of kind of giving a non-answer, but I hope it made sense. Thank you for watching. See you in the next video.